Hey everybody, Steve Cady here with our Doctorate in Organization Development and Change program at BGSU. We have friends of the program as well as doctoral students in the program here today. And thank you, Jillian, for helping us to get organized and to get the invitations out and to help uh, direct this session here today. Thank you so much for being here. And Bill, I'm so glad that you get to do this. When we first met, I think like I said, I fell in love with you the first time we met because I just really connected with your story, your passion for the work you do. So thank you for that and your willingness to share and now actually be a part of our program with our students, which is pretty darn awesome. So thank you for that as well. I think today what we'll do is we will jump in with you and you just share what you want to, and we'll kind of follow along in terms of how we will engage the group and those people that are here or that show up while you're speaking. So, Bill, thanks. Why don't I turn it over to you and you can take it away
Okay,
from us?
great. Well, thanks everybody for coming, and it's great to see some of my Nicholas, Frank, and Teddy. Anyway, and some of these slides will be familiar to you because I'm reusing them, but it's because I like them so much. So let me just get started with that. I'm going to start in the beginning. And I'm going to kind of some things will be familiar to those who have gotten ACT training and some is not. So I just felt like I didn't know where people would be, so I'm just going to do a little bit of review for some of the others. But anyways, this is the beginning. So this is the talk, and just a quick note. This is one of my favorite places on earth right here. It's Wat Chetty Luang in Chiang Mai, and it's one of the most peaceful places on earth. And part of the thing that it just occurred to me as I put that up is one of the themes we're going to be looking at when we're talking about East versus West is this idea that so much of psychology is embedded in our cultures, and so much of psychology is really embedded in Western culture, particularly connected to Christianity. And it's embedded in the theories and techniques and models. And not that it's a bad thing, but it's important to be aware of how religion and early philosophies formed a lot of the foundations of psychology, which is not the case in non-Western countries. They don't have the same experiencing of religion that we do. And it's a really important difference. And one of the things that occurred to me is, if you go to any typical temple in Thailand anyway, the overwhelming likelihood is you're going to come into contact with a smiling Buddha, many, many smiling Buddhas, Buddha smiling all over the place, people in happy poses. And when you go to a Christian or a Catholic church in the West, you're going to come into contact with a dead guy hanging on a cross. And that's a pretty big difference. And the messaging associated with those two religions is dramatically different. One is really associated with suffering. People are inherently evil or tempted towards evil and need to, have religion to make them good. And the other says people are inherently good, and letting go of self and letting go of the construction of self moves you inexorably towards goodness. Very, very different perspectives on self, very, very different perspectives on what it means to be spiritual. And so it's just kind of fun to sort of have these different experiences. This research is connected to, as you guys know, some of you know, like a couple different universities. We're working with Chiang Mai University, with Chulalongkorn, and we've added a few recently. This one here is Royal University of Phnom Penh has started working with us, and Nazarbayev University in Kazakhstan. And I like to tell the story. So this journey of meeting Steve and everything started as a journey, and some of you know this journey story, but it all began, this idea of connecting East and West, has been with me for a while now, probably, gosh, at least 10 years, but it all really kind of culminated in an opportunity to go on a Fulbright year-long experience in China. And this is our Fulbright people. And we were in Shanghai, and we were able to sort of create this opportunity to really learn about differences and ways in which we can connect East and West perspectives in psychology on this particular project. And we, at that time, created the first mindfulness-based conference in at least this university in this area of China, which was really an amazing experience. The students were really great. And it allowed us to really gain an understanding of like the kinds of knowledge and experiences people had there that were quite a bit different from what I had known about in America. And so it was really an enriching experience. COVID came, and Duke Quansheng University, where I was at, is connected to Wuhan University, and overnight everything changed. And it's just an amazing thing to think about. We've kind of forgotten about COVID, but what an amazing experience and time for the world that was. Everything in China shut down overnight. And I needed to leave China right away because at that time, China was the only place that had COVID. And there was this fear that if they could isolate China, they could prevent COVID from happening around the world. I didn't want to go, but I was really forced by the State Department to go. But there was nowhere to go back then. All the planes were stopped. So I only had one destination that I was allowed to go to, and that was Thailand. That was the only place that I could go, and I could quarantine in Thailand for 2 weeks. And so I arrived in Thailand, and I think I've told this story to some. I was really sad. My Fulbright year is now ruined. I didn't think that, the world was seemingly going to a bad place. And the waiter brought me toast. And this toast here is my impression of Thailand. It brought something happy into my life that I didn't expect. And the hotel had a compass on the parking lot, and I kind of, not really mystical or anything like that, but I kind of loved that I was kind of given these two things, a hopeful sign and maybe a new direction. So while I was in Thailand, I reached out to try to find people that maybe I could continue this research with. And I found the Fulbright office in Bangkok was willing to sort of allow me to transfer this research project to work with Thailand. And that just began an amazing, in my world, journey towards a new understanding of East-West perspectives. And in many ways, better than what I had envisioned in China, because Thailand is very 95% Buddhist culture. And there's just a lot of, rich exploration of psychological constructs and theories in a lot of the research universities there. So we formed the first diversity, kind of integrating East-West perspectives with some faculty at Chulalongkorn in Chiang Mai. And we have been working together since then on multiple projects that I'll talk to you about. And I always like to acknowledge the students. These are students from Chiang Mai and Chulalongkorn University. And students from Duke Quansheng University have all been involved in these projects at various levels. And of course, we have, really I've gotten a lot of guidance from the monks in Chiang Mai. Chiang Mai is sort of kind of considered like a spiritual center of Thailand in many ways. And so that you can just kind of get embedded in this culture and learn a lot about philosophical perspectives. Then more recently, we were at Kazakhstan. Kind of the experiences in Thailand branched out to create connections in Kazakhstan here and here, where we were able to work with faculty and medical staff in Astana, which is northern Kazakhstan. And then over here we have Cambodia, where we've been working with faculty on some really interesting trauma research and things related to that in Cambodia. And then we have our Thailand friends over here. This is the first clinical psychologist in Thailand right here who I met the last time. And I don't know, while I was having coffee one day in Thailand, this Squid Game boat came by. I just thought it's a cool picture. I got tagged by the Squid Game person. Okay, so the theme for today quickly is, and kind of this whole idea of East-West is like, psychological science is very weird, and we really need to do something about that. And it just, in my mind, it can't continue to be weird. The second thing is, and I know Frank likes this one, is the solution is the problem. The third perspective in East-West models is people are not problems to be fixed. People do not have disorders. They're not broken. People are human beings that are trying to live with their circumstances that make them struggle at times and make them thrive at other times. But nowhere in there is there a need to give them a name indicating that they're broken. And so almost every person I see now clinically, I always tell them, you have a very, very serious, incurable diagnosis. I have to tell you about it, and your diagnosis is human being. You are a human being, and human beings struggle sometimes, and we can't cure you of that. Therapy should be focused on growth and thriving rather than symptom reduction. Mind, body are completely interactive. And Western psychological theories and techniques are indigenous. Most of the time we kind of hear this idea like, oh, Western researchers are going to go to like the Congo, or they're going to go to like Brazil, or they're going to go to Thailand and study indigenous cultures and indigenous psychology, as if Western psychology is the norm and anything outside of that is folk and indigenous. And it turns out that it's the other way around. Western psychology is a peculiar form of thinking that is not shared by most of the world. And it's not normative. It's arrogant and it's colonial, but it's not normative. And that's really an important concept. So this weird thing, and I know for some of my people that know, one of the big problems in weird is that if you look at a typical psychological journal, you pick one, about 95, 93% of the articles in there will be based on Western samples and Western authors. And that would be fine if the journal was called the Journal of American People, or the Journal of Western People, or the Journal of Western English-speaking people. But no, these journals are called psychological science. These journals are called clinical psychology. They don't contextualize and say that our purpose is to study only Americans. The assumption is they're studying broad principles that apply to all psychological experiences globally. But the reality is they're not doing that. They're selectively reporting on a subsample of the world population by a subsample of researchers who all share Western ideology. And that research is marketed as global. And this is a problem. It's a really growing problem. 85% of the world's population does not live in the West. 95% of published psychological research is on Western samples, which is a minority population in the world. This is a significant problem. And so I put this imagine here. And I've talked to people in Thailand about this, and in China too. I said, imagine if you guys, like tomorrow, all you guys that are researchers, tomorrow you woke up and you started reading your journal articles, and they were all in Chinese. And 95% of the articles called Psychological Science, Clinical Psychology Review, Business, were all in Chinese, and were all based on Chinese samples. And you had no access to understanding anything about your own culture. Think about what that's like for you. So when we're talking to people outside of America, they said, it is weird that that psychology, this field, kind of forces me to read all about Americans all the time in their intro books, in their methods books. We're being forced to sort of learn about American psychology, and there's nothing in here about me. And somehow the West feels that's totally okay. It's kind of weird when you think about it. And so this is a problem that I think cannot continue. So the other thing that happens is Western researchers don't contextualize their research. So you'll see that in a journal article, maybe there'll be a publication that says, I don't know, self-efficacy is associated with cognitive performance or something. And they'll say it just like that. Self-efficacy was found to be related to cognitive performance, period. If it's a Western sample, they'll say it like that. If it's not a Western sample, it'll be contextualized. Self-efficacy is associated with cognitive performance among Thai people. So whenever it's a non-Western sample, it's contextualized by researchers. When it's a Western sample, it's not contextualized. As if, again, the messaging is, when it's Western, it's normal. When it's non-Western, it's exotic, non-normal. And again, remember, we're the exotic ones. We're the minority. We are the weird ones, not the rest of the world. Western researchers and students tend to not cite non-Western research in articles and don't read them because they consider it to be inferior. Western findings are viewed as normative, while non-Western theories are often considered indigenous, folk, and non-scientific. So these biases are part of the reason why we're kind of looking at this East-West integration. It's really important to go beyond sort of what's been done. And it gets a little worse, or I don't want to call it worse, it gets different. So again, I know some of you guys have seen these slides, but this is a map of where all the psychological research is going on. And this map really is a map of prevalence rates of depression and anxiety and various kinds of disorders. And as you can see, there's just literally nothing known, very, very, very little known about a vast majority of the world's mental health. because, again, researchers have been focusing on a small subset of the population. So the goal of our lab and the research we're doing is really to develop methods that can be used to address suffering, but have it be relevant, cross-cultural, and non-weird. And we're really looking at ways to do this is through biobehavioral research, and then applied research, we're developing new theories and techniques. And then most importantly is that every study we're going to do from now until the day I die, I suppose, is going to require international collaboration and multiple authorships, because we really feel like it's time, the time where a Western author can just publish about things alone without even considering getting input from non-Western sources seems like it's outdated. It's easy to get a hold of people now to participate in research. It's easy to reach across the globe and, hey, would you like to collaborate with me on a paper? It's just not that hard to become international at this point. So the projects I'll talk about today quickly is really just the integrating ACT with Eastern perspectives. And we've done a couple studies looking at the Thai USA differences in the way they conceptualize mindfulness. And I'll just do probably 10 minutes on this. So our collaborators are from Cambodia on these projects, at the Khmer Soviet Friendship Hospital, and then, as I mentioned already, Kazakhstan and China. And these are our colleagues from Thailand. Okay, so the typical, CBT approach was you see something happens, you evaluate it as threatening, you'll have a physiological and behavioral response to that stimulus. And that's a traditional empirically based model in the West. And then interventions were designed around this model. So CBT would typically target modifying thoughts, modifying physiology, like with biofeedback or relaxation training, and then skills building to modify problematic behavioral responding. And that's a traditional CBT model that began probably mid-'80s and has continued to this day as a dominant model in intervention research. It's a perfectly fine way of doing research, and it's a perfectly fine way of conducting therapy. The way it's conceptualized is like its mechanism. The mind works like a machine. And a therapist goes in there and takes out the bad parts, fixes them up, and puts them back in nice and shiny. So if you have a thought like, I'm no good, the therapist will say like, wait, that's a bad thought. I'm going to fix that bad thought, I'm no good, and I'm going to help you think of yourself as good. Put in a good part. And that's the basic model of CBT. And there's a lot of focus in CBT on identifying the problematic thinking patterns. So these are just a few where you're magnifying failures, black and white thinking, overgeneralized thinking, catastrophizing. There's all kinds of classifications of bad thoughts that the therapist will fix for you. And if they want to help you from a CBT model, the goal would be to critically examine your problematic thoughts, get the client to agree with you that they're problematic, and then help them replace the bad thoughts with the good thoughts and change their behavior with the goal of reducing symptoms. That's a classic CBT model. And it works. There's no doubt about it. CBT is an effective intervention, way more effective than psychoanalysis or psychodynamic therapy. For almost everything they've measured, they show that they're producing reasonably good effects. So there's nothing wrong with CBT. It's an effective intervention. However, there are some problems from a global perspective and from a science perspective. The science perspective is it's really not tied to cognitive science. People in cognitive science here at BG or other places, they don't have the slightest idea what people with CBT are doing with the C word, the cognitive. It doesn't match up with any of their theories and any of the empirical research on how cognition works. So it's kind of made up. The other problem is there's substantial evidence now that cognitive change is not necessary to improve behavioral change. The assumption under CBT is you have to modify your thoughts in order to modify behavior. Like, I have to learn how to be confident to act confident. And that's simply not true. You can learn to act confident while you simultaneously feel lack of confidence. And that symptom reduction is the most important goal. These are things that are proving to be not really exactly what is consistent with the literature. Other ideas are, these are the social and cultural perspectives in the West, which is one needs to think right to act right. Suffering is bad and should be eliminated. Happiness is good and should be pursued. These are Western constructs. This would all be fine if we could have ways of controlling our thoughts and feelings, but we do not. It's just not possible. Humans cannot control their thoughts and feelings in the ways that CBT says you can. And we can demonstrate that later or another day. So what we do instead now, we have this new intervention. It's called ACT, Acceptance and Commitment Therapy. And acceptance and commitment therapy deviated or moved away from CBT in a number of ways. And one of the more important ways is it abandoned mechanism and embraced this idea of functional contextualism. And I'll come back to that in a minute. The idea with this is that thoughts and feelings are neither good nor bad, right nor wrong, helpful nor unhelpful. It just depends on the context. Everything is context bound. So I'll just kind of skip ahead here. I had a client that I saw today, and the person said, my problem is that I overthink things. And I'm like, oh, okay. So like overthink, what does that mean? And the person said, well, when I'm with mostly in romantic relationships, if my partner doesn't text me back right away, I start thinking, oh my God, it doesn't love me. I don't think I'm like loved by this person. Maybe they're out with somebody else. Starts getting all these really scary thoughts, upsetting thoughts, and then begins to think about like, well, maybe he doesn't love me. Maybe he's this, maybe he's that, maybe he's this, maybe he's that. And like she said, I'm spiraling. And that's what she described as overthinking. Now, from a CBT perspective, that would be a problem. Overthinking would be catastrophizing. Overthinking would be worrying. Overthinking would be illogical. They would be considered problematic symptoms that I would try to help her get rid of, this problematic thinking pattern. But with ACT, we do something a little different. We say, well, this overthinking you're doing all the time, is it like helping? Is it making things better? And she reports no. And you're like, well, why are you doing it? Like, why are you overthinking all the time if it doesn't really make things better? And she's like, I don't know, like, you tell me. I'm like, no, you tell me. The idea here is that she's doing it for a reason. And the reason, going back to functional contextualism, it has a purpose. These overthinking thoughts have a purpose. And CBT is looking in the wrong place. CBT is looking at the thoughts themselves. What is she actually saying to herself? And we've got to fix the things that she's saying to herself. ACT, I don't care what I don't want to say I don't care, but I care little about what she's saying to herself. That doesn't really matter to me. What I'm trying to understand is the function of overthinking. And the function of overthinking in her case is it allows her to escape from fear and sadness. So what's happening is I feel like I'm unlovable. I feel like I'm not a good enough person. I feel like I'm going to be hurt. I don't like that feeling at all. I want to make that feeling go away. The brain says, I can help you with that. Start problem solving and thinking about why your partner didn't text you. Start wondering about what could blah, blah, blah. Start blah, 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 blah. It's just an escape behavior. It's a way that she can escape from feelings by using her thinking as an escape strategy. So the function of her thoughts is escaping from sadness. And we're looking at that rather than the content of the thoughts itself. So the thoughts aren't bad. They're just ways that she's using to escape from something that's intolerable for her, that she feels is intolerable. And the therapy is going to be much different. We're going to work with her on learning how to sit with the feeling of being afraid, learning how to sit with the idea that you're unloved. That's it. We're not going to go into her mind and try to tell her she's thinking wrong. We're going to help her learn how to experience fear and recognize that that's a normal human emotion when you're in a relationship. And that's all it is. Okay, so that's so acceptance and commitment therapy has these 6 components. Acceptance. I have to accept that my thoughts and feelings occur without my permission and I can't control them readily. Diffusion is learning to look at thoughts dispassionately or without believing them to be true. Present moment focus, learning to live in the moment versus in your head. Self is context, recognizing that you can separate from your thoughts. So for this woman that's overthinking, she's saying, I'm unlovable. Self as context is, I tell myself I'm unlovable. it's a thought. It's not who I am. Values is to try to help people identify what it is they want in life, and then committed action is to move them towards those values in the presence of distress. So for her, it's, well, what do you want on your tombstone? Would you like written on your tombstone, you're a really great worrier? Or would you like something else written on your tombstone? And we're going to help her figure out what that is. So ACT says efforts to control unwanted thoughts and feelings will not work. And there's lots and lots of evidence to support that. And having unwanted thoughts and experiences is not the problem anyway. The problem is you're trying to use a control strategy over something that's inherently uncontrollable. And we'll have to demonstrate this just for a minute. I'm going to pick on Nicholas. Hey, Nicholas, how you doing? You look like you're paying good attention there. Hey, Nicholas. So suppose I have a really good polygraph machine. Actually, Anna Marie and Frank know this one, and Theodore too. And it can measure the slightest negative thought or feeling. Okay.
Sure.
Yeah, and I'm gonna ask you to do something, Nicholas. I'm gonna say, like, I would like for you to not have a single negative thought or feeling for the next 5 minutes, and to motivate you, I'm gonna make sure that the polygraph is attached to a gun, and if you have a single negative thought or feeling, it will shoot you. What do you think? What do you think, Nicholas?
My first thought is, if I do have a negative thought and the gun goes off, my faith tells me that I'm going to heaven, and that's okay.
Yeah. So there you go. You're gonna be dead. And what's important about that, that's kind of what ACT looks at. It says, like, we really realize that you can't control your thoughts and feelings for 5 minutes with your life on the line. So CBT says we're going to help you learn how to control your thoughts and feelings on command whenever needed. And ACT says that's just not possible. Now, what I could do with you, Nicholas, I could say, how about you not say out loud your negative thoughts and feelings for 5 minutes? No problem. Yeah. So ACT says, let's not focus so much on things that can't be controlled. Focus on learning to engage in adaptive, helpful behaviors in the presence of thoughts that sometimes are not very helpful. Learn how to ignore those thoughts or not attend to them when they get in the way. And that's really the foundation of ACT. ACT is effective. There's over 1,000 randomized clinical trials on it now, and it's been shown to be equal to CBT, so it's a viable alternative. So great. All right. So why do we want to do more with ACT? Well, the idea is ACT is pretty closely connected to a lot of Eastern philosophies that have been around for a long, long time. So I'm going to just skip ahead. So ACT, says you need to accept that you have suffering and thoughts and feelings are difficult. You need to learn to look at your thoughts and feelings dispassionately, separate from them. You need to be engaged in the present moment and, like, separate yourself from problematic thoughts and feelings, values, and committed action. Well, for, I don't know, a couple thousand years, at least 1,000 years, Buddhism has been saying, you have to accept that suffering brings truth. The source of suffering is attachment or believing that your thoughts are literally true. The end of suffering is to let go of self and let go of control. The path to the end of suffering is the eightfold path, which is right thinking, right, kind of values-directed living. And what's not in ACT is some other things that are central to Buddhism: loving kindness, compassion, equanimity, and impermanence. So it's as if ACT took a lot of ideas from Buddhism. These things are almost directly taken from Buddhism, secularized them, like took them out of their religious context. Or Buddhism isn't really a religion per se, but it's like, a comprehensive way of thinking. Secularized them, and in that secularization and importing to America, seem to have lost the heart of Buddhism, or the heart of this model, which is loving kindness and compassion and appreciative joy. So it's taken some of the parts out, but kind of omitted some of the other parts that were part of a comprehensive system. Now, I don't know why that happened. A lot of people have theories about it. But the early developers of ACT, Steve Hayes, and mostly Steve Hayes, he kind of argues that he just sort of came up with these ideas on his own. but like almost everyone's like, well, it's pretty close to Buddhism. You must have heard some about Buddhism before. And he really kind of denies it. So don't know what's behind that. But all we're thinking is maybe we need to sort of, it might be important to re-embed or reconnect ACT with some of its other components that were built into a comprehensive system of thinking, especially the heart. And so when I taught Frank and Anna Marie and Theodore, you guys got the EPAC side, like you got ACT with a heart. And that's why everybody was crying. But when they do ACT without a heart, nobody cries. So I realize that it's kind of what we do. So we developed a new protocol, a new way of thinking about this in consultation with Buddhism experts and literature review and protocol design. And it takes years to kind of get through this. It took me a lot of time to try to really understand these concepts. And so one meta-analysis we conducted, we wanted to see, well, does Buddhism techniques really work? And we collected about 1,200 possible studies, went through a meta-analytic review, found 59 articles that directly tested specific Buddhist techniques and evaluated their outcomes in, reasonable scientific way. And this is a really complicated slide, but I just want to show you the one is what, the Buddhist principles were shown. These are effect sizes, all to show really pretty substantial impact on well-being in people when they are provided with these techniques. So Pāna is like a meditation. The four immeasurables, which we have here, teaching the four immeasurables, has been associated with significant improvement in well-being and other, variety of, and these effect sizes are all large, meaning an effect size of 0.7 is considered to be large, and these are substantial impact associated with that. So this was the first thing we did as well. Is there something there that's, empirically validated? And there is. So we developed an EPACT intervention, which has traditional ACT acceptance plus the idea that suffering is inevitable, plus everything is impermanent. Those are Eastern concepts. Diffusion plus equanimity, learning to look at thoughts like without judgment, plus letting go, learning to let go of self, let go of connection with thoughts. Added loving kindness, compassion, and appreciative joy, which is not an ACT. Present moment focus, same. Self as context, we move to non-self attachment, which is hard for Westerners, but we felt it's still worthwhile. And values, committed action, the same, and then more meditative exercises. So this is the new protocol we developed. We've been conducting a randomized clinical trial, 60 in each group. Is the goal. I'll say the goal is 60 in each group, and we identified facilities in Ohio, randomly assigned them, and have been recruiting them into the 3 different conditions. And again, our goal is 60 in each group. Measure a number of variables related to well-being among nurses and healthcare professionals. And we do an assessment, intervention, follow-up, and then 2-month and 3-month follow-up. And where we are right now, I'm just going to go through this quickly. We have 42 in the ACT group, so we're almost done. EPACT is going a little bit slower because we had to revise the protocol and the no treatment group. So we'll be done in May with this part of the study. And then we're going to do a cross-cultural data collection in Cambodia and Kazakhstan in May and June. Okay, so that's that. And the other quick thing I'll just show you, and then I'll just stop sharing. One of the other areas we've done, we compared BGSU undergraduates with Thailand undergraduates on multidimensional, how they conceptualize, and this is just cross-cultural, how they conceptualize mindfulness. And we see something interesting here is that Thai students, on these ones here, see themselves as more able to use the positive mindfulness strategies of diffusion, self as context, and values, but they also see themselves as doing the opposite, more of not living in the present moment, not. And so they score high on both mindfulness and not mindfulness. And that's really interesting. And we're trying to figure out what that means. But the kind of ideas we're getting from people in Thailand is they're calling it theory of mind, which is if you're living in a culture that's very mindful, you're more aware of ways in which you're aligned with mindfulness, and you're more aware of ways that you're not aligned with mindfulness. So they just have a more complex understanding of what mindfulness is. And the second study we're doing looks to be true. When we do factor analysis of these scales, the factor analysis for Thai samples looks different than a Western sample, indicating that they have a different way of understanding mindfulness than Westerners do. The Cambodian is something new we're doing. We're looking at, in Cambodia, one of the things that's interesting culturally is that people tend to not express their psychological distress in psychological terms like we do in America, but it may present more as somatic symptoms. So like they have symptoms like, I feel like there's a pressure on my chest from a ghost, or I feel like maybe there's wind coming up from evil spirits and things. So we're looking at how these things map onto traditional somatic symptoms. And just one last thing, and then I'll stop here, is, boy, oh boy, working with Cambodia has been just like a real eye-opening experience. Come on, that's my last slide anyway. One of the things that really, I think, helps with, we're back. Helps with Cambodia anyways, what we're working with is, I'm just really struck by how in America we have trauma-related research and so forth. But in Cambodia, they collect data on, we have a national sample we're working with. And, in that sample, 35% of the people responding to the sample have had a family member killed in the genocide and have been imprisoned. It's just really, this country is recovering from just a lot of trauma. And so when we conceptualize trauma in America, it's really different from the way people conceptualize trauma in countries where, things really went bad and where they are enduring lasting. And so even the concept of trauma differs by culture. So that's all. That was my formal presentation. Look at this. We have 17 minutes to talk about anything you want, or I can answer questions or do anything you would like me to do in these. And we went really fast, I know, but here we are. Frank.
All right, my first question. Could you
Okay.
re-review the bus analogy? Because I've tried to, the bus analogy, I've tried to explain the whole bus analogy. And I think the way that you frame it, the way you talk about it, it's just a simple construct that people can get their head around.
Yeah. So what Frank's referring to is like in ACT, we use a lot of metaphors, and there's a reason for that. And ACT and in Eastern psychology too, they use a lot of metaphors. The idea is that there's ways in which you can help people gain an understanding of a construct without lecturing and without talking. And in particular, that's thought to be helpful because experiential learning may be better than language-based learning. So what Frank is referring to, there's a metaphor we use is like, everybody, well, I could ask, and I picked on Nicholas already, but let's pick on, let's see, oh, Megan, you're here. So you're a friend of Frank's. Hey, Megan. You know what? Something is really good about it is you're an absolutely perfect human being.
She's trying to unmute her phone right now. I could tell.
Oh, did you hear me?
No, and I send the compliment right back to you and the whole group.
Oh yeah, you're totally perfect. You're 100% perfect.
I wouldn't believe it.
Bingo. Okay. So Megan, when I told her she's 100% perfect, she rejected that. She shook her head, said no. I'm like, oh, that's so interesting, right? So like, and then we kind of like with Frank was here, we might ask a person, well, what's wrong with you, Megan? What makes you imperfect?
Do you want me to give a real example?
It's up to you.
Well, I probably do overthink.
Oh, there we go. We have a little overthinker.
Yes.
So anyway, what we do is we can do an exercise like this. We tell people you're perfect, and automatically people reject that. They say, no, I've got many things wrong with me. I'm an overthinker. I'm too fat. I'm too thin. I'm too this. I'm too that. I'm too this. I'm too this. I'm not cool. I'm ugly. Many, many things. So it turns out that humans are really good at picking up ways, very unhelpful ways of thinking about themselves. And the metaphor that Frank is referring to, it's almost as if in life you're driving a bus, and a human mind is like a bus, and every once in a while you pick up a passenger, And some passengers are nice, but we periodically pick up really very unhelpful passengers that say, you're no good, you're not smart enough, you're not cool enough, you're an overthinker, you're a this, you're a that. And the passengers get on the bus, and in the human mind, the problem is they won't get off the bus. So once they're on the bus, they stay on the bus. And what we say in ACT is, if you end up trying to drive your bus and you're arguing with the passengers all the time, trying to prove that you're not an overthinker or whatever, then you're not able to focus your energy on the path ahead. You're looking back and you're not driving forward. So the metaphor there is you're picking up passengers, the passengers won't get off the bus. And if you argue with them, it doesn't do much for you. The best you can do in therapy is learn how to drive forward, move your bus forward, drive towards your values, Frank, in the presence, fully in the presence of unhelpful passengers that will tell you that you're not eligible, not smart enough, not good enough, they're gonna be there. So the goal here becomes learn how to move forward towards your goals and values in life with unhelpful thoughts that will periodically get in the way, try to get in the way, but don't let them drive the bus. And does that help, Frank? So that's kind of the way I think about that metaphor. And again, CBT was like, no, you need to get the passengers off the bus to drive well. And X said, no, you don't. Just, you can learn how to, and we've talked about this too, every time I give a lecture like this, right now I have for sure one of my passengers saying like, they're bored. You're not making enough sense. You should have done more work on this. You should have been more interesting. You're blah, blah, blah. And I just got to say, thank you. I'll give you another one, Frank, just quickly. I can't tell you the full story, but about a week, 4 weeks ago, I got a bat out of my basement. I picked it up and it was a long story, but I started thinking that, did I get rabies? And, I didn't know if I had rabies. And then, I decided not to get the shots, but now I have a new passenger. So I had a sniffly nose yesterday and a new passenger showed up and said, rabies, you got rabies. So it's going to be with me for a while. My rabies passenger. Yes, Lori.
So you mentioned that you did both the Buddhist example of mindfulness, and then you said that it left out parts of the heart, and then you said that when you put in the ACT portion, that you were reintroducing the heart. In Christian and Jewish theology, the heart's the center of the will, or what one desires. What would that be in Buddhism?
Oh yeah, so that's really interesting, and again, in Buddhism, the heart, well, the position in Buddhism that people, I'm not a Buddhist expert by any means, so I'll just give you my understanding. I kind of think of this not so much in religious terms, but more in terms of ways of understanding the human mind that have been developed within a religious context in a way, but but I'm not, because when I'm working with my colleagues in Thailand, they're real Buddhists and they know so much more than me. But the central position in Buddhism, as I understand, is that people are inherently good and people will gravitate towards goodness if they let go of the story of self, if they stop arguing with passengers, if they stop engaging in beliefs about the self that are kind of acquired through life, if they can learn to let go of that, they will gravitate towards good naturally and be compassionate and loving and kindness. So that's the position. And so the meditations are always organized around what is your ultimate purpose? Your ultimate purpose is compassion, love, and kindness towards others, no matter what. And so anything that moves you away from that central value is thought to be unhelpful.
Okay.
So they're probably similar in that way. I would say there's some similarities.
I would think so. Yeah, I would think so. I guess when I'm thinking about the way in which you presented the Buddhist faith, it wasn't so much in contrast to the way that I understand Christianity as a faith leader.
Yeah.
So for me, I was thinking, there's a movement within the Christian faith, at least within mainline tradition, that is pushing up against the idea of the fall and saying, you know, everything here was created good. And that part of what we have understood, or maybe what people have written about as like original sin or the fall, is actually a coming of age for the earth creature or the human being, that the human being has to be outside of perfection to appreciate the call towards perfection. And when I say perfection, I don't mean you get everything right. I mean wholeness, ultimate peace, you know, and all these things would touch on those variables that you were lifting up around Buddhism. And I'm just wondering how those things, because to me those things are, you know, congruent and not at odds with one another. And
Yeah,
the
yeah.
yeah,
No,
and
I
the
think,
the
yeah.
suffering piece that you were bringing up about the way the Catholic Church would, you know, most Christian churches would have an empty cross as a sign of victory, but a Catholic church would have a suffering Christ on the cross, to basically say this is what the world does to unconditional love.
Mhm. Yeah, I think it really interesting question. You know, I think you could do a whole lot, you could develop ACT with a Christian element component. I think that'd be really, really interesting. So I can't really comment on like I'm not a religious scholar, and so I can't really put it together. Why we're looking at Buddhism is just because the original conceptualization of ACT is very closely tied to like the principles that were in, I don't even want to call it Buddhist, but just Eastern principles in general. The idea of non-self-attachment, letting go, being mindful, being present moment are just really congruent with that model. So we just thought that's the most natural place where we could gravitate towards. But yeah, I think you're right. I mean, there's a lot of cool ideas about, you know, so much of and this is really an important thing. Like Western psychology is very much preoccupied. Western psychological science is very much, don't let me do this anymore. Western psychological science is very preoccupied with separating itself from religion.
Mhm.
And that's very uniquely Western. So when I'm over in Thailand, they're like, why are you guys so bent about like keeping religion out of science? Like, you're so weird about that. But they have a different history. In Buddhism, they embrace science. So if science says evolution happened, the Buddhists say, good. If science, so there's no history in Thailand of competition between religion. And so they see there's no need to like segregate them at all. So that's a uniquely Western problem. And
Mhm.
and it was hard for me to get around that because, like, you know, I was kind of brought up in the West. I'm like, if I'm a scientist, I can't possibly be dealing with spiritual stuff. I mean, that's not scientific. But, you know, now I'm much more flexible about these ideas, and they're just ways that, you know, people developed strategies for how to live successfully in life. And some of them probably have very good empirical foundations, and some maybe don't. And so the goal is to find out how they can work and if they match a culture in one way or another. But one thing that I did want to mention about, which is one of the things we do find interesting in West versus East, and I want to do more on this, is if you're working with like Thai students, you say like, you know, the fundamental belief of Buddhism is you're not there. You are not there. There is no you. There is no I. And then if you attain enlightenment, you will come to realize there is no I and you disappear. And in the moment that you disappear, you're enlightened. So, yeah, enlightenment means you're born into non-consciousness. You're no longer there. And that's the ultimate. That's the realization. Of course, Christian is more, I am a soul that is permanent and like immortal, and I live forever. So very, very different constructions of self. And if you go to Thai culture, say like, let go of self, they're like, yeah, totally good idea. I think I really need to let go of self. I can be a better person. And in the West, you say, let go of self. They're like, what will I become? They're kind of nervous. Like, if I let go of self, what happens? Because it's pretty contrary to like what we've been taught. And so there's really different ways that people conceptualize this construct. And I think these are all really interesting things that like we're trying to like figure out in the way that people respond to these interventions. Yeah,
Thank you.
Anna Marie.
I would like to offer an idea to this conversation because I find it really fascinating, and I've had a little more time to chew on this idea of like the act and the how it kind of all fits in. But I think one thing, like being a Christian person myself, I think in our neck of the woods, so like Western culture, we have been so ingrained. I say we, like Christian, Western Christian people, that we aren't supposed to suffer. And so we don't
Right.
accept the suffering of it. And so then you introduce something of this, like this idea of
Nicholas.
um, these kind of more Buddhist ideas that we're told are not good in the Christian culture that we live in, right? Or they're contrary to believing Jesus or whatever. I think that it's some of it is because it has been so westernized. But when you start to dig into the Bible and you look at the Greek and the Hebrew meanings of things that the Bible actually says, they really align a little bit more than what like in the Bible, it says, you will suffer and you should not worry about it, right? Because every day, new mercies every day. And Jesus, like, you don't need to worry because all your needs will be provided for, right? But we take on like this worry, and then this worry causes all of these other things that lead us to these spots where we're not very good mentally, where other cultures are like, oh, I'm going to be today where I am today. I'm going to accept the things that are happening today with where I am today. So I think there's some of that is like what we've been taught, or at least from my perspective, having been able to chew on this a little bit and think about how do you look at this from a Christian perspective and take the parts of it that make a lot of sense. And if you I've already said how I believe God created science and asked us to ask questions and asked us to question him. So why wouldn't we do those things, right? That's just my own 2 cents I thought I would add to this. I
It's
have
really, really
enjoyed
cool ideas, cool questions. No, I agree with you. And I think that suffering, I do agree that many religions deal with suffering pretty well. And that Western culture did move into this like happiness is the ultimate and suffering is bad. And like you should just pursue happiness and avoid suffering. And really religions are, I think, much more, good about that in the Eastern cultures too. Like, no, suffering happens. Learning how to live a good life in the presence of suffering for a greater good is like the ultimate purpose. And I think that's true. And we kind of got caught up. Well, it just happened in the West where like they figured out humans are inherently kind of like unhappy. We're just good at being unhappy. I'm not saying we're unhappy. We're good at like being worried and stressed and unhappy. And then the marketing firms kind of figured out like, wow, I have an idea for a commercial. We'll tell you if you buy this thing, you'll be happy. And then people are like, oh, wow, I'll totally buy this thing in the hopes of pursuing happiness. But of course, the happiness is short-lived. And then this is perfect for marketing because, right, that you have a population that is chronically searching for happiness, and you just make sure your advertisement links them up with happiness and they'll chase it. So that's why, if you're going to smoke Newports, they don't put a Newport commercial up with like unattractive, bored people. They're all smiling on a sailboat, having the time of their lives. And you're like, oh, if I have a Newport, I'll have one of those, or your beer, or your this, or your that. It's kind of capitalizing on our tendency to be rejecting suffering and chasing happiness. But yeah, I have to run, guys. I'm so sorry. I got to go teach a class. I'm going to hypnotize them today. I'll hypnotize you guys if you want someday. Oh, I can't hear you, Steve.
Yeah, thanks. Sorry about that. Thank you, Bill. That was awesome. It just opens up the fun Pandora box of really a lot of cool things and ideas to discuss. It's kind of a nice little appetizer taste to what your class is going to be like and the experience the students are going to have with you, which is really wonderful. Hopefully they'll all get a chance to watch today just to
Yeah,
get,
and I'm going to make a slide of you guys because, like, as I go through all these
yeah,
people that have been transformational in my life, definitely this program has just been an amazing,
yeah.
cool, amazing group of people. And like, you got something really cool going on here, Steve.
Thank you. Thanks, Bill. And you've been a gift as well. So more to come. Enjoy your class. I'm heading off to
See you
graduate
later.
council.
Yep,
He's headed off to
bye-bye.
his thing. So everybody have a great day. We'll be talking soon. Bye for now.
Bye.